Hi, I'm Gigi Schweigert, and today we're at the JFK Medical Center in Edison, New Jersey. I'm speaking with Dr. Karmani. So tell me a little bit about your training and how you became a neurologist and specifically working in the area of stroke.
So this neurology has a very comprehensive kind of approach to the stroke care. And once you become a neurologist, after medical school you spend 4 years training in neurology, you can go into different kinds of training facets of stroke care. So first thing I did was I did a 1-year fellowship in stroke care, and then I added another year in neurocritical care, and then 2 more years for neurointervention. So 4 years after the neurology training was completed, I did it at Ohio State University, then going on to Buffalo SUNY State University of New York, and then ended up in New Jersey, and I've been here since 2003, initially at UMDNJ, and now here at JFK Medical Center, taking care of the stroke patients and doing stroke intervention and neurocritical care.
Wow, that's an absolute amazing amount, and really a lot that you sacrifice in order to give your time, in order to learn all that you know about stroke. So I think that it's very important. I know me as a mom of 4 and with my own parents and family, that when I'm looking for care, I'm looking for someone who's passionate about what they do, which is obvious with Dr. Karmani, and also someone who is extremely knowledgeable, not just knowledgeable about the regular and average and the typical techniques and procedures that you can do regarding stroke, but those that are taking us into a more innovative time, things that are more comprehensive, and an opportunity to get the very best care available, not only in the tri-state area or the United States, but really the world. So tell me about the comprehensive program. If my mom were to come here tomorrow, what would she experience and what could I expect from you?
So excellent question. Like the Stroke and Neurovascular Center itself in New Jersey has a very rich history, and it has evolved over time. We were actually the first center. The Middlesex County was the first place where stroke interventional treatment was done in 1956.
Wow.
And it's a huge
1956.
1956, first place in the United States to do actually stroke intervention. And since that time, we've had a very rich tradition where we were the first in the state of New Jersey to get this comprehensive designation, have these huge, nice, beautiful biplane angiography suite where we are standing in that provides the best of the best care, most advanced care, the minimally invasive neurosurgical treatment of aneurysms, of stroke patients, of bleeding in the brain, all facets of what a stroke may be, which is a temporary disruption of blood flow. And designation-wise, awards-wise, we were always first in New Jersey. And one thing that is very surprising to people, 10 years in a row, we've been the top-rated stroke hospital in New Jersey.
But why don't we know that? Like, I live in this area. I've been here for 20 years, and I don't know that for 10 years, this is the top-rated stroke treatment center in New Jersey. So that's why we're saying this. This is great. So beyond knowledge and the very best equipment, I think something else from the patient perspective, which I'm speaking from, I haven't had a stroke, and I hope I don't have one, but at least I'm learning a lot about it right now in anticipation of if anything were ever to happen, is having that camaraderie with staff. So just in entering JFK Medical Center, I was treated really well. No one knew who I was, and opening doors and helping me out and assisting me to where the ladies' room is, and those little things. And as much as all this big equipment and all the things that you do, and we're going to talk about some of those procedures later, are very essential, what's also essential is that human touch, that part of someone thinking, I trust you, I believe you, I feel like you're knowledgeable, and I'm willing to let you care for me.
Well, that's a very, very important piece, and that only happens when the team comes together, and the rich history and tradition of stroke care at JFK has allowed that to happen. Our team right now is multidisciplinary. There is a care from the point the patient is received by the EMS. We have our own critical care transport, own EMS system at JFK, which provides the care for the stroke patient from the time the patient is in the ambulance. And our ER has been dedicated towards stroke care. Our ER is going to be first in the nation, as we are in the rebuilding process, to have dedicated stroke bays just dedicated to the stroke patients. And from the ER, the patient is received in interventional suites if they need to, where minimally invasive neurosurgical procedures are performed here. And if they need to go for open neurosurgery, we have state-of-the-art neurosurgical operating theaters upstairs where the patient can go to. And from there onwards, neurocritical care is the next component that comes in. Most places have medical ICU intensive units, surgical intensive units, but what we have, which is very unique, is that we have neurocritical care intensive unit, which is very unique to just providing care for neurologically sick patients. From there, the patient can go to a stroke unit, which is also a dedicated unit for just stroke care, and we have a state-of-the-art rehab center, which is a part of the JFK Medical Center, and that's what makes it so comprehensive from the very start to where the patient is actually sent home in a good state. We have the ability to provide that longitudinal or kind of a comprehensive nature of stroke care with a very dedicated, very thorough kind of a medical care that is provided here.
It sounds great. So this is what I hear as a patient and a layman, is that from the moment you call 911 in the ambulance to when you get into the emergency room to triage and then deciding where you go from that point, that I'm going to get the benefit of seeing the same team members over and over, which I think are so important to patients. You sit in that hospital bed and you wait all day for the doctor to make his or her rounds, and being able to know that you're going to get one of those team members who's going to follow you from the moment that you arrive in the ambulance all the way to, I think one of the other doctors told me earlier, and I'm going to speak with him in a little while, is that till you're ready to go to work or home. So carrying you through the entire process, which is an incredible help in someone getting better, not just through the procedural techniques that you have, but also through someone feeling good and confident and knowing that there's someone there they can trust.
Yes, that's the whole point. The whole point of Stroke and Neurovascular Center is to provide that continuity and provide that integration of care. And it has happened over time. It has happened in a very meticulous fashion. And it has happened with individuals who are dedicated and who are really, really willing to give their all for the care of the stroke patients.
That's great. So in a little while, too, we're going to hear the perspective of a patient and her experience and how things have worked. So Dr. Karmani, thank you so much. We'll talk again, but I'm very excited remembering that this has started in 1956.
Yes.
Wow.
The first stroke patient was treated a long time ago, and we had the first biplane angiography suite in 1990s when nobody had those.
Right. So I'm assuming that you're going to continue this routine and practice of always being on the cutting edge and always getting ready to do the next thing. And I think I'm going to hear some of those things of how you've taken those steps that no one else has taken in the United States either. So thank you. Hi, I'm Gigi Schweikert, and we're at the JFK Medical Center in Edison, New Jersey. I'm speaking with neurologist Dr. Musavi. Tell me how this room, what's the name of the room we're in?
So this is a Neuro Interventional room. It is biplane room that we lately built this room. And we do all our Neuro Interventional cases here.
Great. So this is a room that anyone who has experienced a stroke would expect to spend some time in.
Yes, almost.
Almost. Okay, so almost. So what happens and why is this room so special?
Yeah, so this room is the place that patients who needs any type of neurological intervention, they come here and they get the procedure that they needed done. Okay. So basically, when if we divided the different type of patients that we get here, first we go amongst the stroke patients. Usually, stroke means acute neurological event, which can happen most of the time because of other closing of the vessel or bursting out of the vessel,
Okay, so either a closing
or
a
the vessel bursts up.
Okay.
Yes. So closing of the vessel could be in the arterial side, which is the vessel which feeding oxygen and glucose to the brain,
the one that's coming out of your
out of our heart. Yes.
Okay.
Or it could be in the venous side, which is the vessel which take the blood and toxins away from tissue and take it to the liver and lung, and then they get oxygen and come back to the heart.
Right. All right. So what are some of the interventions that might happen? What are categories of intervention? What would be the least invasive, and then kind of take me through?
Okay. So for this occlusion or halt of the blood flow into the artery, initially it depends if patient needs any IV medication or not, which these things, if patient needs it and if patient is within the window time that we have, patient receiving this IV medication in the ER.
Okay.
And ER is exactly behind this room, and CT scan is exactly behind that room. So patient then obtains a CAT scan, and if patient needs any intervention, meaning that if the clot that is closing the artery or any type of plaque that's closing the artery, if this needs to be treated or opened up, then patient ends up being here. And when patient comes here, then we have different devices that first we can deliver blood thinner inside the certain vessel which is closed off, or mechanically we can take the plaque or clot which is closing off the vessel and take it out so that the vessel is opened up in timely fashion.
All right, so let me ask you a question as you're explaining this to me. So if a vessel closes, it might be because something's blocking it.
Yes.
Does a vessel ever close just because it's pinched or because it's closed? Or is there...
It can happen. Pinching vessel is rarely can happen, but most common cause of the stroke is just closing up because either the clot is in there or the plaque is growing up and closing the vessel.
And the plaque we're talking about is basically could be heart disease or kind of us not exercising or the way we eat or things like that.
Exactly.
All right, so maybe we'll spend some time later on educating everyone, including myself, about all those pieces. Okay, so once someone has that, and they've come into this room then, and they might get IV, and they might be administered some medication, which would be a blood thinner to kind of dissolve the clot. What else might happen?
Regarding the other part of the stroke patients, as I mentioned earlier, is when the vessel bursts out. So there are many other reasons that this happen. One of the more common one is aneurysm. So if aneurysm bursts out, then we take the patient here, and again, we go into the vessel and we try to close off the aneurysm with different platinum material, naming coil, that we have. We put the coil inside the aneurysm, we pack the aneurysm so that the aneurysm doesn't bleed anymore. Or the other example is arteriovenous malformation, which is basically malformed connection between arteries and veins, that these ones have a tendency to bleed as well, which we can do the same thing that we do for aneurysm, but different material usually. We close off the sick vessels, which are the source of bleed.
Okay, so with an aneurysm is a bursting of the vein. And so what you... Artery. Okay. What's the difference in an artery and a vein?
Vein is the vessel that taking the blood with toxins and without oxygen or less oxygen to the liver and lung, and then oxygenate.
The artery has
fresh food, oxygen.
Okay, so it's the bursting of the artery.
Yes.
Okay, so the aneurysm is the bursting of the artery. So you want to go in and stop that bleeding, and you can do that through certain techniques, but here's my question. So the blood that was going there, where does it go now?
They go to the brain. So that's the point, that because since brain is in a confined place, naming a scalp, there is not much room for blood to go. And as soon as bleeding happens, the pressure inside the brain goes up and prevents blood to supply the brain anymore. And that's why it is very urgent to take care of them as soon as possible.
Awesome. All right. So it sounds like there are so many different things that you can do to help people once they've gone down this unfortunate road. Is there anything else you want to add?
Yes, in addition to these procedures that we do, also there are tumors that they are highly vascular, meaning that they have a lot of vessels feeding this tumor. And we go in and close off the feeders that feeding the tumor, and consequently the tumor shrinks down or dies. That's another thing that can be done. Also, there are many patients that they suffer from bleeding from the noise, that open surgery is not the option. And we go in and close off the vessel that's causing the bleed, and they are fine afterward without having any open surgery done.
You know what? That's amazing. And funny thing, or not so funny thing, but I've had both those experiences in my family. My son suffered from severe nosebleeds and had to have exactly that technique. Okay. My brother suffered from an adenoma that was very vascular, meaning it was full of blood. And what basically you're going in and cauterizing, right? Or in a way, yes, just making sure that all those vessels are blocked off so
yes,
that blood can't flow.
Yes. In addition, basically from upper chest up, whenever we have any vascular problems, especially narrowing of the vessels, like carotid narrowing or subclavian artery narrowing that's feeding the arm and the vessels of the back of the brain, or the narrowing of the back of vessel that feeding the back of the brain, naming vertebral arteries. We go in and we open them up, put a stent there, and come back without any scar, anything. And patient the next day, most of the time, goes home with no any complication or problems.
It's amazing that there's that amount of technical innovation and things that can be done for us here. So we'll talk more about it later. Hi, I'm Gigi Schweikert, and today we're at the JFK Medical Center in Edison, New Jersey. And we're going to learn a lot of things about their stroke treatment center that you're probably not aware of. I'm here with neurologist Dr. Panazai. Tell me a little bit about your title, what you do here.
Hello. I am a stroke neurologist at JFK Medical Center. I'm the medical director of the Comprehensive Stroke Program.
That's wonderful. Now, how long have you been doing this?
I've been doing this for over 8 years.
Wow. So what are some of the symptoms that you might anticipate for someone who is having a stroke?
Well, basically a stroke is, what a stroke is that there's a sudden disruption of blood flow to specific parts of the brain. So a blood vessel is blocked off, and depending on which area of the brain is not receiving blood flow, patients will have symptoms that, according to that area of the brain that's dysfunctional. So they may have symptoms including things like weakness on one side of the body, numbness on one side of the body, severe headache, trouble with their vision, dizziness, difficulty walking. It could be a number of neurological symptoms.
So let me kind of say it back. So basically a stroke is when blood is not flowing. Is that right?
Absolutely.
Okay. And some of the symptoms then would be a weakness or a pain or losing breath, you said?
Well, so weakness, losing sensation, difficulty walking, dizziness, difficulty seeing, all of these could be some symptoms of stroke.
So at what point would someone who's experiencing some of these things reach out to a medical professional?
The best time would be immediately. You know, we say in the stroke world, time is brain. So the quicker you recognize the symptoms and the quicker you call 911 and come to the hospital, the quicker we can do something to try to intervene and help people.
I'm the kind of person as a mommy of 4 and who's a little bit embarrassed sometimes if I don't feel well. So I think there are a lot of people out there who might be like me who kind of say, oh, I'm going to feel better, I'm going to be okay. What if we were actually to call 911 and it wasn't a stroke? How does the hospital feel about that?
That's okay. We err on the side of being cautious and evaluating every patient and taking every patient seriously. So any person who has a sudden neurological symptom should take it seriously and shouldn't hope that time will take care of it. JFK was certified as a comprehensive stroke center back in October 2012, and we were the first in the tri-state area and the 8th in the nation to receive this honor. So it's a big deal.
So this was in 2012, and you talk about the tri-state area, which means New York, New Jersey, Connecticut. And I think sometimes we're always thinking that, I know I live in New Jersey, that maybe the best is across the way, through the tunnel, over the bridge to Manhattan. And what you're telling me is that it's not necessarily true.
Right. You don't need to run over there to get your stroke care. We have it all here.
And that's great, and also 8th in the nation. So that's really very impressive. So as you're thinking about that, the people in your lives who could be at risk for stroke or yourself and looking at those symptoms, first thing to do, make sure that you call 911, even if it's not a stroke. Better safe than sorry, and know that the JFK Medical Center, the stroke program here, is one of the first ones accredited in the tri-state area and only one of 8 in the entire nation. That's good care. We're with a doctor who is a neuro interventionist. And so let's talk about that a little first so that we understand the difference between a neurologist and a neuro interventionist.
Basically, the neuro interventionist is a physician who does the procedure and goes into the brain and the neck and do different type of procedures.
All right, awesome. Now you're going to introduce me to one of your patients who's actually had the benefit of some of this knowledge and this incredible facility and the program you have at JFK Medical Center.
Yes, we are fortunate to have Kim here with us. So basically, Kim was presented to the hospital because of headache, and her imaging showed that she has obstruction of the venous system in her brain, which we gave her conventional treatment, meaning that we gave her heparin drip. She didn't respond to heparin drip, and she was getting worse. And the imaging that we did showed that the main vein that is draining the top of the head to the back was closed off, and also the right side vein was closed off, and the veins in the deep side inside the brain was closed as well. So we ended up putting a catheter inside her brain and try to take the clot out, which conventionally, usually they leave this catheter the most for 24 hours up to 48 hours, and they inject certain amount of blood thinner or clot buster, meaning the naming TPA, inside the brain, which we did so, but unfortunately she didn't respond to this conventional treatment. Then we went in again and we put the catheter higher, and we delivered twice of the dose that has been done so far of blood thinner TPA in her brain for not 1 day, not 2 days, not 3 days, for 6 days. It was there, and we were doing angiogram, getting imaging to see if the clot is resolved or not. And after 6 days, when the clot started dissolving, then we took the catheter out.
Wow, that's amazing. So tell me how you feel about what happened. You started with just having headaches?
Yeah, I had really bad migraine.
And that was like every day, or?
No, it started one day, and then I had migraines and vomiting, and my husband just said we need to go.
Good. So that's what the doctor was telling us before, that when you're feeling that, to come right away. So how did you feel when your clot was resistant to some of the typical and more traditional procedures?
Oh, let me explain this part. She was, during this time, after the 3rd or 4th day, she was in such a critical situation that she lost her consciousness. And she was intubated, and she was under hypothermia, meaning that we cooled her down because the pressure inside the head was too high. Despite of putting drain inside the head, it was in 60s range. Normally it should be less than 20, so more than 3 times. And so she was totally out, and for 20 to 30 days.
Wow. So with what they've been able to do, how do you feel from when you had the headache, and how do you feel now after that procedure?
Much better.
Are there any things that are a little bit harder for you or a little bit different?
My speech was a little off when I first came out, and I have some issues with tingling in my legs, but it's all improving.
Well, I've never met you before till today. So if I didn't know your story, I wouldn't know any of this had happened. I would see you and speak with you, and your speech sounds wonderful, and you look beautiful, and so it's really sounds like a miracle. So I'm assuming that after this incredible procedure of doing this for an extended amount of time over days, offering double the dose, that you're writing a paper about this. Is that happening?
Yes.
And you'll be presenting that, I'm sure.
Yes. Definitely.
And so the things that are happening here are not only cutting edge, but you're cutting the edge. So what I could anticipate is some of the other centers around the country will start to use this procedure.
Hopefully. We are gathering our cases that we've done such a high dose medication and such a longer period of time catheter being left inside the brain, and we're going to publish them when the number of the cases are enough.
That's great. So is there anything that you would want to say to your doctor that maybe you've already said before, but for the benefit of our audience?
Thank you for saving my life.
Yeah, and it really was life-saving. And what would you like to say to just the general population about having a really bad headache? Or, I mean, did you ever anticipate this would happen to you? I mean, did you have things that kind of led up to this that when you look back in hindsight, or did it just come on really quickly?
I may have had things, but I probably just ignored them. So I just think it's best to get things checked out no matter what.
Right. Okay, so it comes again, that same message of education, making sure that we are responsive to what our body's telling us. Seek medical attention, even if we find out that it's not needed. That's the greatest thing, but seek the very best medical attention. And if you are experiencing a stroke, this is the place to be, the JFK Medical Center in Edison, New Jersey. Hi, I'm Gigi Schweikert, and we are at the Neuro Interventional room at JFK Hospital in Edison, New Jersey. This room is very special. I'm with Ray and Romeo, technician, head of nurses, who are going to tell us about how their equipment, which not many places has, works, and how their team is able to be incredibly responsive to the needs of every patient despite the differences, complexities, and the severity. So Ray, this room you spend a lot of time in.
Yes.
And the equipment behind me, do you want to start with telling me a little bit about the history, and then tell me about where we are today and the equipment that we have housed here now?
Yeah, it started in 1997, which is when I started here, actually. We had the first biplane room on the East Coast for neuro intervention.
I'm going to stop you for a second. So we're going to go back to geometry for just a second. A plane is a flat surface, right? Bi is 2. And so biplane, I'm assuming, would it be perpendicular where it would be crossing?
So it would be a way of taking a picture simultaneously from the front and the side at the same time, so we can see on 2 planes. It also gives us, these rooms are technically advanced, especially now to the point where we have this brand new state-of-the-art room. We can create 3D images, which then allow us to look at the vessels of the brain, and we can spin them in circles, up, down, left, right, and really get a good view of what.
Because the brain is really a kind of an oblong sphere, and so if you're just doing one plane, you're really not getting everything. And when you're doing the biplane, as a mommy of 4, I'm gonna have to kind of relate it to like 3D ultrasound. Is it like that? Only better?
Very similar to the idea of a 3D ultrasound, so you get a 3-dimensional image, which is exactly what we can get here.
That's amazing. And then so how does that procedure happen?
The procedure of the whole process starts off in the ER, which you've heard before, and by the time they hit CAT scan, which is very in close proximity to the ER and us, then they come right into our room. We get on a table, and as you see behind us, we have the machines here to do it. And we inject dye and take pictures, and off of those pictures we create images that we're then able to find out where the clot is in the fastest time possible, and then we can go up through the vessels and go after that clot to pull it out.
Because in a stroke situation, time is of the essence. You were telling me the emergency room's kind of back here. There's a CAT scan room over here, and then this room right here. So when we do that, when you do that biplane, not me, although that'd be fun to work that equipment, is that it has to go really quickly. And so getting this imaging so that the physicians that we've spoken with, the neurologist and neuro interventionist, can look at that really quickly. So tell me, what's quick?
Well, what's quick is how the team comes together. Everyone works together. Everyone has a job. So we can get the patient through this process onto this table as fast as possible. Time is brain, so the faster we can get you on this table, get you ready, and get going, then that's how you save brain. And if a second stroke were to happen while this stroke's on a table, we're actually one of the only facilities in the entire area to have a second biplane room all set up for the same situation, so we can get another patient going.
Oh, so we have two people simultaneously having the same procedure, whereas someone wouldn't have to work. Wow, that's great. Someone wouldn't have to wait. So when you talk about that team, Romeo, do you want to tell me about the team and how you're responsive as a group of professionals and how that benefits the patient?
As Ray said, this is very important. Always, time is brain. So the nursing staff also are part of the interventional team, which is we call the stroke intervention team. And anytime they need us within a matter of 30 minutes, we're here to support them. We have qualified nurses. They have the training. They have the education to be able to take care of the patient before the procedure, during the procedure, and after the procedure.
So they are quicker than a pizza, all right, to your brain. And so what I'd like to do, too, one of the things that I noticed in looking at the machine is that it's not enclosed. And those are little things that really make a difference to the patient. So we're going to look at the machine in a little bit, but working here as a tech and having gone through these things, how does this empower you to do the very best for the patient?
Well, having the state-of-the-art equipment allows us to give them the best possible treatment as fast as possible. So it's nice being able to work with equipment that is up to date, cutting edge, and allows us to do everything we can for the patient as fast as possible.
That's great. And it's right here in New Jersey.